Hi everyone, I am Cendrick Abenoja from BSN 212H, Group 29, and today I am going to do the intradermal medication administration. So, in performing, you need to check the doctor's order. Next is check for the medication administration record. This is to prevent the medical error by giving the medication to the client. Next is check the label of the medication carefully against the EMR. This is to make sure that the correct medication is being prepared. Next is follow the 3 checks for administering medication. Read the label of the medication. Okay. First is when it is taken from the medication. Second is before withdrawing the medication. And third is after withdrawing the medication. So next is organize the equipment. This is to save time and energy. So in preparing medication from the vials, first perform hand hygiene. This is to deter the spread of microorganisms and to prevent cross-contamination. Next is prepare the medication vials from drug withdrawal. Next is mix the solution if necessary by rotating vials between palm of the hands, not by shaking. Because if you are going to shake the vials, it makes bubbles. Okay. Next is remove the protective cap or clean the rubber cap of a previous open vials with an antiseptic by rubbing the circular motion. So I am going to wipe the protective cup because it promotes sterility. So I am going to discard this cotton box. Next is withdraw the medication. So first is attach a filter needle as agency practice dictates to draw up premixed liquid medication from the multi-dose vials. So first, I am going to open the tuberculin syringe. And I am going to insert the filter needle. Next is attach the filter needle as agency practices dictates to draw up premixed liquid medication from the multi-dose vials. So ensure that the needle is firmly attached to the syringe. Okay, I am going to discard this. Next is remove the cap of the needle, then drawn up into the syringe the amount of air equal to the volume the medication to be drawn. So next is carefully insert the needle into the upright vial through the center of the rubber cup, maintaining the sterility of the needle. Next is inspect the air into the vials, keeping the bevel into the needle above the surface of the medication. Next is withdrawn the prescribed amount of the medication using either of the following method. So I am going to use the second method, which is invert the vials. Ensure the needle tip is below the fluid volume and gradually withdraw the medication. So I'm going to invert and so okay, I am going to recap it and I am going to replace the original needle. So I am going to insert the original needle. So in administration of intradermal, first explain to the client about the medication. So sir, this medication will produce a small wheal, sometimes called bleb. A wheal is a small raised area like a blister. So as I insert this syringe to your skin, you can slightly feel prick. And next is provide privacy. So I already closed the door so that no one from the outside can disturb us while doing the assessment. Next is select and cleanse site. So I am going to use his forearm to inject the syringe. Next is avoid using sites that are tender, inflamed or swollen, and have lesions to avoid any further complication to my client. Next is apply clean gloves as indicated by agency policy, and cleanse the skin at the cleanse the skin at the site using firm circular motion. So I am going to um, put these cotton balls to the skin and in a circular motion. Okay, I'm going to discard this. Next is prepare the syringe for the injection. First is remove the needle cap while waiting for the antiseptic to dry. Next is expel any bubbles from the syringe. Small bubble that adhere to the plunger are no consequences. Grasp the syringe in your dominant hand close to the hub, holding it between thumb and forefingers. So hold the needle almost parallel to the skin surface with the bevel of the needle up. So next is inject the fluid. So with the non-dominant hand, pull the skin all at the side until it is taut. So next is insert the tip of the needle far away to the place in the bevel through the epidermis into the dermis. Next is stabilize the syringe and needle. Inject the medication carefully and slowly so that it produces a small wheal on the skin. Next is withdraw the needle quickly at the same angle at which it was inserted. Activate the needle safely device and apply bandage as indicated. So I am going to discard this. Next is do not massage the area because I am going to observe for the skin test. And next is remove gloves and discard the gloves. So I'm going to discard this. Next is perform hand hygiene. This is to deter the spread of microorganisms. So next is circle the injection site with ink to observe for redness and induration per agency policy. Next is document all relevant information, records the testing material given time, and dose and route. So next is evaluate the condition of the site in 30 minutes, depending on the test, and measures the area of redness and induration in the millimeter at the large diameter and document findings. So lastly, document if the client had positive or negative skin test result, and follow agency protocol on labeling of allergies. So that's all, sir, and I hope that you are okay. And also, all the information gathered in this assessment will be kept as confidential between you and me. So that's it, guys. Thank you for watching. Good day, everyone. I am Cendrick Abenoja from BSN 212H, Group 29, and today I am going to do the Intermuscular Medication Administration. So, in general preparation, you need to follow the 4 steps like what I did while ago. And next, in preparing medication from the ampule, first is perform hand hygiene and observe other appropriate infection prevention procedures. This is to prevent the spread of microorganisms. Next is prepare the medication ampule from the drug withdrawal. First is flick the upper stem of the ampule several times with the fingernails. So as if this is the ampule and I'm going to flick it several times. Okay. Next is uses an ampule opener or place a piece of gauze pad or alcohol wipe between your thumb and the ampule neck or around the ampule neck and break off the top by bending it towards to ensure the ampule is broken away from you and away from others. So I am going to open this gauze pad as a opener. So I'm going to place the antiseptic packet over the top of the ampule, breaking off the top. So I'm going to break this ampule. So I'm going to place the wipe and dispose it to the container. Next is withdraws the medication. So first is place the ampule on a flat surface. So I already put the ampule on a flat surface. Next is attach the filter needle to the syringe. So first I am going to open the syringe. And attach the filter needle. So I am going to discard this. Next is remove the cap of the needle or the filter needle and insert the needle into the center of the ampule. Do not touch the rim of the ampule with the needle tip or shaft to avoid injury. So I am going to put on the center and with a single dose amount, hold the ampule slightly on the side if necessary to obtain more than order amount of the medication. So, okay, I am going to next is dispose the filter needle by placing in a sharp container. So I am going to dispose the filter needle. And if giving an injection, replace the filter needle with a regular needle. Tighten the cap of the hub of the needle and push the solution into the needle to the prescribed amount. So I am going to insert the main needle. So now we are going to administer the intramuscular injection. So first is check the MAR and check the label of the medication carefully against the EMAR to make sure that the correct medication is being prepared. So by checking the label of the medication, this is to prevent the medical errors by giving the medication to the clients. So next is follow the 3 checks for administering medication. First is check the medication. Read the medication. First is when it is taken from the medication cart, and second is before withdrawing the medication, and lastly is the after withdrawing the medication. So next is organize the equipment. So I already organized the equipment. This is to save time and energy. Next is perform hand hygiene, and this is to observe um, other appropriate infection prevention procedure. This is to deter the spread of microorganisms. So next is prepare the medication from the ampule or vial for drug withdrawal. So I already prepared the medication from the ampule. Next is provide the client's privacy. This is so that the no one from the outside can disturb us while doing the assessments. So next is prepare the client. So sir, are you all set? Thank you. That's good. So next is prior to performing the procedure, introduce shops and verify the client's identity using the agency protocol. So sir, may I see your wristband? And can you please state your full name and your birthday, please? Okay, thank you. Next is assist the client in a sitting position depending on the chosen site. So my target is his deltoid muscle, and which is this part. And next is obtain assistance in holding an appropriate client. So sir, kasabot man ka og Bisaya, di ba? So that's good. So explain the purpose of the medication, how it will help, and using language that the client can understand, include relevant information about effect of the medication. So sir, karon kay mag-inject ko sa imuhang bukton. And after that, kay maka-feel ka og kanang dizziness, kanang malipong ka, and also kanang panghawoy sa imuhang bukton. Pero later on kay mawala na siya kay it means kanang nagsakit imong bukton, kay it means ang tambal na ako ang inject kay nag-effect na siya sa imuhang lawas. So next is select, locate, and cleanse the site. So I am going to select this site, which is his deltoid muscle, and I am going to cleanse it using the swab cotton balls. Okay, I'm going to discard this cotton balls. Next is select a site free of the skin lesion, tender, and swelling, hardness, or localized inflammation, and one that has not been used frequently. So this is to avoid any implication from the client. So if injections are to be frequent, alternate sites, avoid using the same sites twice in a row. So sir, okay lang man ni ka nang wala naman ninyo mo ginagamit, di ba? I mean, gina-inject, di ba, diri ang part? Okay, that's good. So, next is locate the exact site of the injection. So, okay. Next is apply clean gloves. So, I already wear my clean gloves. Next is clean the site with antiseptic swab using a circular motion. So, I am going to clean the site and in a circular motion. Okay, I am going to discard this. Next is prepare the syringe for injection. Remove the needle cover and discard without contaminating the needle. So I am going to discard this. So next is inject the medication using the Z-Track technique. So, holding the syringe between the thumb and forefinger as if you're holding a pen, and pierce the skin quickly and smoothly at a 90-degree angle. So, I am going to inject it. And next is hold the barrel of the syringe steady with your non-dominant hand and aspirate by pulling back on the plunger. With your dominant hand, aspirate to 5 to 10 seconds. So if blood appears in the syringe, withdraw the needle, discard the syringe, and prepare a new injection. So if the blood does not appear, inject the medication steadily and slowly, approximately 10 seconds, while holding the syringe steady if using the deltoid muscle. Okay, after injection, wait 10 seconds if you are using the deltoid muscle. Next is withdraw the needle smoothly and the same angle of the insertion. So I am going to withdraw the needle. So apply gently pressure on the side and dry sponge. Next is activate the needle safely device or discard the uncapped needle and attach syringe into the proper receptacle. So I am going to uncap the needle and discard this. Next is remove gloves and perform hand hygiene. So, second to the last procedure, documents all relevant information, the time, administration, drug name, dose, route, and the client's reaction. And lastly is assess the effectiveness of the medication at the time it is expected to act. So, sir, if you have, we are done, and if you have any questions or if you feel something, just call immediately your physician so that the physician will assist you on what to do. So that's it, guys. Thank you for watching. Good day, everyone. I am Cendrick Abenoja from BSN 212H, Group 29, and today I am going to do the subcutaneous injection administration. So, in general preparation, you need to follow the 4 steps, like what I did a while ago. And in the administering subcutaneous injection, first perform hand hygiene and observe other appropriate infection prevention procedures. This is to deter the spread of microorganisms. Next is provide the client's privacy so that no one from the outside can disturb or interfere our assessment. So next is prepare the client. So sir, are you all set? Okay, that's good. So next is prior to performing the procedure, introduces and verify the client's identity using the agency protocol. So sir, may I see your wristband? And can you please state your full name and birthday, please? Okay, thank you so much. Next is assist the client to the position in which the arm, leg, or abdomen can be relaxed depending on the position or depending on the site to be used. So the position that I did is the supine position, and I am going to inject in this site, which is his abdomen. So next is obtain assistance in holding an appropriate client. So sir, makasabot man taog Bisaya, di ba? Okay, that's good. Next is explain the purpose of the medication and how it will help. Using language that the clients can understand includes the relevant information and about the effects of the medication. So sir, karon mag-inject ko sa imuhang tiyan, and ang kaning injection ang ginatawag nato nga subcutaneous injection. So ma-feel nimo unya kay redness or makita nimo kagad unya kay redness and maka-feel ka og itching. So ayaw lang siya og kanang katula sir kay para ma-avoid nato ang further implications sa imong sarili, okay? That's good. So next is select and cleanse or clean the site. So I am going to expose his abdomen. So next is select size free of tenderness, hardness, swelling, scarring, itching, burning, or localized inflammation, and select site that has not been used frequently. So, sir, dili sir, kay katul siya or dili? Okay, dali ata mag-inject unya, sir, ha? So, next is apply clean gloves. So, next is using the non-dominant hand, pinch or spread the skin at the site and insert the needle using the dominant hand in a firm, steady push. So, I am going to pinch his abdomen. And when the needle is inserted, move your non-dominant hand to the end of plunger. Some nurse finds it easier to move the non-dominant hand to the barrel of the syringe and the dominant hand to the end of plunger. So next is remove the needle. Smoothly pulling along the line of the insertion while depressing the skin with your non-dominant hand. If bleeding occurs, apply pressure to the site with dry sterile gauze until it stops. So next is dispose the supply appropriately. So I am going to dispose this. Next is assist the patient in the comfortable position. Flip down medication ticket if not using EMR. And do aftercare. So remove gloves and dispose used item in appropriate waste receptacle. So return other equipments and perform hand hygiene. This is to deter the spread of microorganisms. So sir, I am going to assist you in a comfortable position. Okay. Next is I am going to remove the gloves. Second to the last procedure, assess the effectiveness of the medication at the time it expected to act. And lastly is document all the relevant information. So, sir, we are done now on our assessment. I would like to inform you that all the information gathered in this assessment will be kept as confidential between you and me. Okay? Thank you. So, that's it, guys. Thank you for watching.